Wales is really leading the way when it comes to seeing the benefits of arts and being creative on people's health and well-being. It's very much now moving away from the clinical model of health and looking at the whole person and the whole individual, not only their clinical needs. And that's what the role of the Arts and Health coordinators and the partnership the Arts and Health Council and ourselves have got is to raise awareness of the wider benefits, and especially around the preventative agenda, keeping people well at home in their communities.
The Arts Council wanted to ensure we could have coordinators in every health board in Wales. We offered partnership funding for 3 years, £75,000 over 3 years for each health board to engage an arts and health coordinator in their health board. A kind of bridging role between these two worlds, between the arts and health. We wanted them to be able to be aware of the challenges, the priorities, the pressures the health system's under, and respond to those with creative ideas.
The programme overall has been extremely successful. It's underpinned a whole series of arts and health activities in various health boards, and where there's been an existing arts and health coordination function, it's augmented and amplified the activities that they've been able to develop and deliver.
What we've been able to uncover is just an extraordinary appetite and enthusiasm and need really for arts and healthcare right across the health board. An example would be where we've introduced a whole creative collective, which really is a community of creative individuals from right across the health board to take part in creative activities led by artists and musicians.
One project that I've initiated as Arts and Health Coordinator is called Finding Hope Within Loss and Bereavement, for staff to have the opportunity through creative methods and through the arts to talk openly and be supported regarding some of their feelings following loss, grief and bereavement.
When I was appointed 10 years ago, I brought in digital storytelling skills, and it's just grown and grown and grown. And now it has been adopted as a Once for Wales policy, that this is how we gather our feedback from patients.
Here at MIST works with young people and families where the young person is either in care or at risk of being in care. But one of the things that was missing was, where are the young people in here? How do they see themselves reflected in their space? So we worked with an artist, Ben Connors, and a musician, Alex Lupo. And so the young people were exploring their own identity and what did they want to share of themselves, and how would that make this their space.
The recent installation down at Cardiff Royal Infirmary is really where we see the programme going, to see people who are often underrepresented, people who don't necessarily feel valued within society, being asked for their voice, for their opinion. It changes their impression of the health service, of the NHS.
So one of the most important success factors is the sheer quality and capability of the arts and health coordinators themselves. They are, for the very most part, people with deep commitment, deep skills, and they have inspired their colleagues, and they've attracted additional funding, and they've helped to make arts and health work really something that's very well respected within the health board at a variety of levels.
So what I've found over the last 2.5 years is that I have a colleague with an amazing set of skills that are different to mine, with a different set of experiences, which gives me a fresh outlook on some of the projects that we've been reinitiating or initiating, a way of reaching out and finding different ways and different approaches to fielding information and encouraging other staff from across the health board to contribute to our art strategy, for example.
I believe in the potential of the arts to make a difference, and finding the language that enables other people to feel safe and that there's something worth trying. And it doesn't always work. You know, so you have to be tough enough to take the fact that each of your projects might not be the most successful project. So I think there's something about taking a risk, keeping an open mind, but mainly being interested in what are people's needs and how do we meet them.
I think that having people who think differently and more creatively alongside people who understand the health board, which is quite complex and can be difficult to navigate at times, has really benefited us as a team.
I'm really more engaged with artists and arts organisations, and I'm lucky to have the support of both Simone and Alex, who really look after the more of the governance side. So we work as a team.
Alex understands the arts, although her background is much more administrative. So she's really good at making sure that we stay within governance, that procurement and all the finances are covered. And then Mel brings the magic. And it's really hard it's really hard for me to talk about that because you can't find that on paper.
One of the most important success factors is there being within the health board senior leaders who will give space and support to arts and health work, either at board level or senior management level or both. And that's critical because this is a small function within the overall health board activities, and it's very easy for small functions to be overlooked, to find it difficult to know exactly how to make the connections that they need to. So having that senior sponsorship has been very, very important.
We are getting a huge amount of leadership and senior support for the arts and health agenda within Hywel Dda. This is very much in part because the chair of the health board, Maria Battle, is a big advocate and ambassador for arts and health and passionately believes in it. But also we've established an arts and health steering group, of which she is the chair, with representation from heads of service from right across the health board.
One of the things that was really encouraging for me was on my very first day that the Executive Director of Public Health had made time in their diary to meet with me. So automatically there was a sense of feeling support for the role, and also a clear sense of purpose and intention in terms of this is what we'd like to see from the role, this is what we're hoping you can achieve in the role. And a clear sense of, and we're behind you in delivering that. This is what we need to help make the case for arts and health.
So we've had incredible senior support over the years from our chair, from directors of nursing, all sorts of senior people who have really supported what we've done. And it's a key reason why it's grown and been successful. The risk comes when management changes, and it's changing all the time. I think in 10 years there have been 5 different CEOs at Swansea Bay and the same number of directors of nursing, and every time you have to begin practically at zero to help them understand the value of what you're doing, to help them get really behind what you're doing. And it's an ongoing task to build senior support. You have to keep doing it all the time.
One of the things that makes quite a difference is if the arts and health coordinators can key in their work to the overall objectives and strategies of the health board itself. That way the work they're doing reinforces what's happening in the health board and what the health board is trying to achieve. And of course, from the point of view of the boards themselves and senior managers, if they see arts and health coming in behind them, supporting, helping to take forward those objectives, that's a very powerful and positive message.
I think looking at our own strategy, where are we really going to go with that? What do we want to do as an arts and health service? And what strategic priorities we are going to look at ourselves? Because if we look at the health board's ones, it's so vast, it's really difficult. So we need to narrow that down and look at what we want to do over the next 5 to 10 years.
The idea of bringing in a strategic role is to start to create some sense of thematic work, a sense of organised structure to some of that work, and create a sense of development and planning moving forward with that work. So it's targeted and has a thoughtful approach in terms of the communities that most need support in terms of public health priorities and health board priorities within that work.
I think the arts programme, in aligning with the health board strategy, gives it a lot of power. So we're able to show the results of engagement with our staff members, with patients, with community members, and with a whole network of artists. When that's done well, we can start to look at how the creative arts can improve our services and reduce pressure on NHS services. So many of our projects have been looking at how we can redefine and reframe our services for the future in giving our communities a voice.
This is a small function within overall health board activity. So making partnerships, getting volunteers involved, attracting additional resources either from within the health board or from external charities and other sources, that's very important to be able to grow the function and give it enough critical mass to be noticed and to be regarded as having real value within the health board as a whole.
An example of really good partnership working and networking that we're doing is the Swansea Bay Arts and Health Forum, where the worlds of health, arts organisations, third sector and local government meet up, attempting to bridge these different worlds that don't usually talk very well together, I guess. Lots of new connections have been formed. There's a real buzz in the room because we're all looking for our colleagues that we can play ball with, so to speak, and find ways of reaching more people and giving them as much support as we can.
Rhan bwysig o fy ngwaith fel cydlynydd celfa iechyd ydy gwneud yn siŵr bod gwasanaeth drwy gyfrwng y Gymraeg. Fel rhan o hyn, dwi'n gweithio gyda rhwydwaith staff sy'n siarad Cymraeg i ddatblygu prosiectau celfa iechyd, a dwi hefyd yn gweithio gyda'r gymuned i wneud siŵr bod gwasanaeth ar gael i unrhyw un sydd eisiau gwasanaeth trwy gyfrwng y Gymraeg ac i hybu'r Gymraeg yn y gweithle yn y bwrdd iechyd.
Looking at the resources that we've got at our disposal in Powys, a huge rural county with a small, very dispersed population, we do benefit from some great arts organisations that are quite geographically well placed, including a lot of arts practitioners who've got experience of working in arts and health or in social inclusion settings. For instance, we're at the Mid Wales Arts Centre today, which is up near Caersus, near Newtown, but we've also got theatre venues, we've got arts organisations that do community outreach work and work in schools. So these resources are absolutely essential to the role. Without the providers out there in the kind of landscape, as it were, it would be incredibly difficult to introduce arts in health settings if we didn't have that range of experience and quality.
Each health board has provided the governance and accountability for the work. So that means it's been quite a mixed picture, and because again it's a relatively small function in the overall scheme of things in a health board, that means the governance hasn't necessarily been very strong and well developed. As the programme transitions to more mainstream funding, if it's successful in doing that, then the question of governance and accountability will be one which will need to be attended to in a bit more detail.
I think we've been developing the reporting mechanisms as the role has progressed. I think when I was initially enrolled and I was within child psychology and the transformation programme, I was answering to child psychology and the transformation programme. So in some ways, the wider health board could just be happy that some additional work was happening. And making the case for the value and how that's reported has been really interesting, because I think in some ways when the money's coming from somewhere external, there isn't quite such a sort of rigour in, is this delivering value for money for us? So I think one of the challenges for me has been to sort of say, hey, this is of value to you, and for that value to be recognised and owned by the Health Board.
The current structure is the Regional Partnership Board, which speaks to the Together for Mental Health paper, and so we contribute to that, we report to that. But actually the accountability routes are various because of course we have to report to the Arts Council as funders as well, also to the local authority where we're partnership on projects and on the development of the strategy. So this is done via reports and publications that go to these places. But equally within the Health Board we're working very much with the overarching strategy there for people's health in Powys, and as well with the One Plan in Powys for the council. So the accountability lines are various, but as far as I see it, they're very compatible. So going forward and building on the evaluation, our hope and our intention is that these posts become embedded within the NHS and secured for the long term. We really want to see access to the arts and creative activities being just a normal, everyday, routine part of healthcare provision across Wales.
I think that the key learning for us is that we're at the beginning of the journey in some cases, and there's an opportunity now through the independent evaluation to really raise awareness of the significant difference that the arts and health coordinators have already made, and the opportunities that we have in Wales now to embed their role and the work that they do further across the NHS in Wales.